Hello, I'm Bronwyn Eisen, and welcome to Pure Health News. We have traveled to the high desert today, where you will be meeting Dr. Kelly Hong and some of her patients. And today's program is all about cosmetic dentistry. So if you're unhappy with your smile, I encourage you to watch today's program.
Well, I first saw this office just driving by because I worked 2 buildings over, and I wanted something convenient, and they worked out so that I could come here during my lunch hour and get my work done and get back to work. It was really a great deal that they helped me through. And I really had a lot of faith in Dr. Kelly once I found out that she also taught at Loma Linda.
I've been looking for a dentist because I'm petrified of dentists. And I opened the paper one day and I saw her picture, and there's a write-up on her in the paper, and she just seemed so friendly. So I called her, and that's how it started, actually. I saw her paper in the paper.
She realigned my front teeth, my top ones, made my line the correct way, got rid of my space, and made me the smile I've always wanted.
So today's topic is all about cosmetic dentistry, and you are known here in the high desert for cosmetic dentistry. Why don't you tell me about your background?
I'm an active member of American Academy of Cosmetic Dentistry, and I have a lot of credentials from them. And also, I have an implant training from Loma Linda University as well, where I teach right now too.
All right. Now, why did you choose to go into cosmetic dentistry?
It's like this. My grandparents, and they're missing a lot of teeth back in those days. And when I was kids, when I look at them, I was like, they don't really smile. And then one day my grandpa got this denture, and then he got new teeth, and he started smiling a lot. And that was my first impression of a smile. I loved it. When I look at them, I was like, wow, they actually smile. They like me, I see the love from them. So I thought that was my first view of smile when I was kids. That's what I got from them. And then after I become a dentist, and I see people's life changing, and those are just like incredible. I mean,
I want to go back to the life-changing in just a moment, but first, do you do general dentistry here as well?
Yes, I do.
Okay, so do you see children all the way to
Yes.
whatever age anyone's still getting their teeth cleaned at then, right?
Exactly.
Okay.
We're a full family practice, emphasizes with cosmetic dentistry.
Okay, now let's go back to the dental implants. So you do the dental implants?
Yes. Well, dental implant is actually what it is replacing the missing area. And then what it is like the screw goes into their jaw, and then we replace the tooth on top of it. So it's going to just act like their natural tooth, and they don't have to have dentures or anything wearing that area.
Typically when someone's missing a tooth, they're having it replaced with a bridge or maybe a denture, but you're saying a dental implant is almost like their own tooth.
Exactly, and also it's not only just their own tooth filling, because the bridge involves several teeth. So once they get the bridge, in in like 5 years or 10 years later, they need to have all that redone, or it's going to involve several more teeth in it later. So you're not only looking at just one missing area, you're looking at other problems later on. So dental implant is definitely a way to go.
So what you're saying is if there are missing teeth and someone were to get a bridge, then they're going to have it replaced, and it can affect the other teeth. How does it affect the other teeth?
So what a bridge is like, you have to use the adjacent that area, the two teeth, at least 2 teeth involved, and you have to grind the 2 structures, and you have to use those 2 teeth to replace that missing area. So it's involved is actually at least 2 teeth.
So getting the dental implant, basically, you're not involved in any other teeth, and you're able to just replace that missing area.
Most likely.
Most likely. I would imagine it's a case-by-case scenario.
Right.
What if a patient is missing all of their teeth? Are dental implants a good option for them?
Yes, definitely.
Okay.
Those patients will have a great benefits out of implant. As little as 2 implants or 4 implants we can put in the bottom area and secure the denture, or sometimes we can place a little bit more implants and they can get rid of the denture. And what's good is they don't have all the acrylic part that actually, so they actually can even taste the food better and they function better. And also for the denture patients, a lot of times their denture gets really loose, and that's why they don't like to smile, or they don't want to eat something hard, or apple, for instance. So But with the implants, they can get a lot of benefit, which is they can smile again and they can actually bite their apple, and they can show their big smile to their loved ones too.
All right, so now it's obvious that if someone's missing teeth, they're a candidate for cosmetic dentistry,
Exactly.
but who else would be a candidate?
Anybody who's not happy with their smile right now, anybody. I see patients where their teeth are severely rotated, crooked, and very yellow, but I want to approach to the patient where it's more conservative, where it's more easier and less painful way to treat it. So there's a lot of cosmetic dentistry, for instance, there's Invisalign where, they don't have to wear the old traditional braces, they can wear the clear trays, and it's just every 2 weeks you just get the new trays, and then before you even know, you get the new smile. And that's what all my patients say, I thought I just started it and then now I have a new smile and this is over. Exactly. And people didn't even notice that they were wearing Invisalign. So that's another really good one of the conservative approach that I do it. And also there's a lumineers, which is available.
What are lumineers?
The lumineers are very thin porcelain veneers that goes on top of the patient's teeth. And it can help improve their smile, and also it can permanently whiten the teeth as well. Yeah, it's very simple procedures, and it involves, most likely a lot of my patients were done without anesthesia, which is, they get a lot of fear of getting shot, and you rarely feel it, and it's usually 1 or 2 days procedure, so they love it, and they can be pretty quick changes too.
Okay, so if someone who had a chipped tooth or a cracked tooth, is that someone who would be a candidate for a luminaire?
Most likely.
Okay. Yeah. Now, I have a question, because I've seen people, and I've also heard the question before, if there's one single tooth, say the front tooth, that has maybe a chip or a crack, is it tough to match that tooth with the others?
Yes.
With the color and everything?
Traditionally, they use like a porcelain crown, which is, it has a metal inside and outside porcelain. So as time goes by, they start seeing the black line, and you can't really match exactly like the natural tooth. But with the lumineers, we can help a lot of patients.
That's when you start seeing that gray area,
exactly.
Correct? And with the lumineer, you don't get that effect.
And sometimes if the patient already has a, their crown, and they don't want to go through all removing their old crown, and then lumineer can be placed on top of their old crowns or bridges if there's no cavities or anything.
When we decided to do this piece on Dr. Kelly, it was all about her smile makeovers and her continuing education in dentistry. However, after sitting down with some of her patients today, they were so impressed with her personality, her charm, and her chairside manner.
I did feel self-conscious about my smile. My teeth were not all the same color, and now they are, and I feel happy about smiling.
My smile before lumineers was kind of narrow, and some of my teeth were shorter than the other ones, and being in the dental field and being an assistant, that's the first thing people look at you, is your smile when you're working on their teeth.
Well, I had my tooth, one of the teeth was actually like coming out because I had like a lot of bone loss. So I had a gap and then the tooth was falling out, so I wouldn't smile, so that's pretty much it.
Like, I never like showing my teeth, my bottom row especially. I try to talk like without showing my bottom row. And I work with people, so that was another big thing too. And it's kind of embarrassing when you don't have the smile that you want, but you're constantly talking with people. And with getting married, I was going to be having like a lot of photographs taken, and these were going to be pictures that I was going to be looking at, for years to come. And so I wanted my smile to be the best smile that I could ever have.
I work with the public, okay, so my smile is very important. It portrays my position, who I am, and how people portray me. So yes, you try not to smile as much, and I'm the type that loves to laugh and smile, and I came and saw her to see if we can make it better.